Good evening, everyone. This is my first time to attend the IRA convention, and I'm very humbled. And I'd like to thank Jaffron and Helen Philippines for inviting me to share our experience regarding the use of HA130 in combination with hemodialysis. So our hospital is a tertiary hospital located in Makati City, Philippines, which stands over 50,000 square meters with over 600 beds. And our kidney unit is a modern facility performing hemodialysis, peritoneal dialysis, hemofiltration, hemodiafiltration, charcoal hemoperfusion, but now it's the resin hemoperfusion, SLED, and continuous renal replacement therapy. So according to the Institute of Health Metrics and Evaluation in the Philippines, CKD in our country is the fifth most common cause of death and disability for all ages combined in the Philippines. And there are about 2.3 million Filipinos suffering from CKD. And according to our National Kidney and Transplant Institute, one Filipino develops CKD every hour and more than 70,000 undergoing dialysis. So as a background of our observation, we have unfortunately 4 patients to present undergoing maintenance hemodialysis in series with hemoadsorption. And we have a very limited access to hemoadsorption because of its cost. And according to this experience, we have one patient who developed hypersensitivity reaction to HA130 manifested as maculopapular rashes and severe pruritus after initiation. So we included those patients who are on maintenance hemodialysis undergoing 3 times a week, hemodiafiltration in series with HA130 with 4 hours duration, and once a week hemoadsorption. And we also included those patients who had uncontrolled hypertension in spite of maximum medications and target dry weight. And also those patients which has limitations of activities and emotional health problems. We attributed this to a minor depression because of restless leg syndrome and peripheral neuropathy. And of course, the last is a poor sleeping pattern. So the objectives of this observational study is to show whether the combination of maintenance hemodialysis could increase the clearance rate of middle and large molecule uremic toxins, and to show the improvement in the quality of life of our maintenance hemodialysis patients, and to show if combination hemodialysis and hemoadsorption can reduce mortality. So these are the baseline characteristics of our 4 patients undergoing MHD at Makati Medical Center. As you can note here, we have 2 females and 2 male patients. Their age range is from 44 to 77 years old. Only one of them was diabetic and the rest had hypertension. And the duration of hemodialysis for patient 1 is 15 years, 2 and 3, 7 years, and patient 4, 11 years. And the duration of hemoadsorption for patient 1 was 5 years, patient 2 and 3, 1.5 to 2 years, and patient 4, 8 years. So these are the baseline characteristics of patients that we had in our center. And we were able to review the biochemical markers from baseline up to 2 and 5 years. And as you can see here, patient 2 and 3 and 4 had significant elevations in their blood pressures. But after 1 and 2 years, you can see here a significant drop in their blood pressures. So we also had the chance to review their calcium values, phosphorus, hemoglobin, CRP, interleukin-6, beta-2 microglobulin, intact PTH. This is one area where we used hemodialysis in series with hemoadsorption, but the intact PTH or the PTH levels were very high. And maybe these patients already have refractory hyperparathyroidism. But we also included here CT ratio and the LVMI, or the left ventricular mean index. So to show you a rough a graph, no, this is in the albumin levels. Hemoadsorption improved the appetite of the patients, resulting to maintain albumin levels. As you can see here, from baseline, they have patient 2 and 3 had low albumin levels, but as they continue, after 5 years, they gained stable albumin levels. In terms of calcium, you can see here they have elevated calcium levels at the start, and low calcium levels, I'm sorry, they have low calcium levels at the start, and then they were able to maintain a stable calcium levels at the end after 5 years. The next could be the phosphorus level. As you can see here, the phosphorus levels were elevated at the start, but after 2 to 5 years on combination hemodialysis and hemoadsorption, their phosphorus levels became stable and normal. The same is true with the hemoglobin levels. This has been quite important because over time, their hemoglobin levels has been stabilized. The CRP levels, as you can see here, they started with very high values, and towards the end of the 5-year treatment, they showed a significant decrease in the CRP levels. For the interleukin-6, you can also show here at the start that they also have high or elevated levels, and towards the 5th year, they were significantly reduced also. Beta-2 microglobulin, the same. They started as high levels and then slowly progressed after the 5th year to a reduced level. For the CT ratio on chest X-ray, it was a stable CT ratio, all of those patients, the 4 patients. And for the left ventricular mean index, you can see here at the start, they have a high LVMI. The normal for the LVMI should be 79 grams per meter squared for men and 61 for females. Towards the end of the 5-year treatment, you can show here a decrease in the LVMI level values. So in summary, we were able to do a combination of maintenance hemodialysis, and it could increase the clearance rate of middle and large molecular uremic toxins, and we were able to show the improvement in the quality of life of maintenance hemodialysis patients, and we were able to show that combination hemodialysis, HA, and hemoadsorption using the HA130 can improve the quality of life. So there was a decrease in inflammatory markers, improvement in the physical health problems, patients gained more energy and emotional stability, and they generally had a good sense of well-being. Thank you so much.
Thank you very much for this very important presentation reporting your experience.